The coronavirus pandemic is ravaging the state of Utah.
This morning, America's healthcare workers sounding the alarm as coronavirus cases surge across the U.S.
This morning, Utah's doctors are sending an urgent warning. Hospitals are running out of ICU beds.
Everyone was terrified in the beginning. Everyone was questioning their own mortality of how we were all going to survive this virus.
You can't imagine the emotional, the physical strain that we are putting on our healthcare providers.
There was disappointment, at times anger, just why can't people understand?
People just are going out and living their lives, not realizing that they are exhausting our healthcare system.
The bravery to not leave was paramount.
Several weeks ago, as the COVID-19 began emerging as a potential public health concern, teams at the University of Utah Health launched the infrastructure and protocols designed specifically to protect patients, visitors, faculty. The first that I really started realizing this is a serious event is really seeing that globally, Italy, and then coming into Seattle, and then understanding how that would be impacting our healthcare system.
There was this unusual respiratory illness, pneumonia, that was being reported out of the wet markets in China.
We all knew that COVID was going to change how we delivered care. When we saw first things unfold in China, then we saw the Lombardy region of France just shut down.
And we started talking about what we were going to do if we ran out of ventilators, and how we were going to make the decisions we were going to have to make. I came home and I was like, oh my God. I told my wife, I'm like, oh my gosh, I never thought I'd have that conversation in my life. Like, who decides who dies?
By late January, we had an idea that it really was going to come to the United States, and we might not be equipped to really track it well. But nobody, even in the early days, anticipated the kind of impact it would have.
And once we had our first patient in the state of Utah in early March, we knew it was just a matter of time. And then we received our first COVID-19 positive patient here at University of Utah Health. And I believe it was the week of March 6th and 7th, we put up our tents a little bit early for some. And within a week, we were shutting down our elective surgeries, and we were reducing clinic visits, and we were really preparing for the virus to take hold.
Let me have you put this mask on for me, okay? I'm going to give you a mask and have you put it on your face.
What's happening here today is we are testing our plans and processes related to COVID-19.
So we actually had a little bit more lead time to be able to strategize, which really, really helped us, I think.
Nobody here rested on their laurels waiting for something to happen and hoping for the best. They just came out and went to work and started preparing.
If you don't have a strong trust and culture that I believe we had coming into the pandemic, it was going to be difficult for us to respond the way that we did. And we responded in an extraordinary way.
Good? Everybody good? Yep.
We were all in this place where we knew that whatever we did, the potential for dramatic loss of life on the scale that we've never seen was real.
In late January of 2020, we started our meetings as we were monitoring the news reports coming globally about COVID-19. We created a structure called CELT, our COVID Executive Leadership Team, and that's been in place and is still in place today. We took our CELT group and divided into 10 other subcommittees that handled areas such as logistics, operations, pharmacy, ambulatory services, our workflows, our supply chain, because PPE was obviously a big topic early on of would we have enough masks to make it mandatory at the time before anyone knew that we should all be wearing masks. So a lot went into that, and the structure is what helped us and empowering our teams and our people.
We started just by thinking, how can we find out every day how many nurses we have, how many doctors we have, how many ventilators we have, how many beds we have, how much medication we have. And so we just started there.
We basically just had a blank canvas to paint on. We had never done this before. We didn't have anything to base it on, so we had to create it from a start.
And the leadership, has led the way, but I think the creativity at all levels. I mean, this really was kind of a bottom-up and not just a top-down
You know, the patients are obviously the most important, but without a viable, healthy workforce, it's difficult to take care of patients. So the first and foremost is to, number one was protect and retain our workforce.
Holy cow. We're running a personal protective equipment, or PPE, donation drive, where we're collecting items from the community.
We saw stories on the TV about people wearing garbage bags and having to have their own mask for over a week and maybe even longer. We did not want that for our staff.
We created a recycling unit within our hospital at one point to make sure we had enough masks. We created a hospital within a hospital in our B50 unit to take overflow COVID patients. We just did what we had to do.
We're here hopefully to inform, keep you up to date on both policy, process, things that are happening.
We were daily live streaming at any given time of either clinical or operational information to our both faculty and staff, leaders within the organization, understanding what we were doing.
It makes me feel proud that we were transparent, honest, candid. When we didn't know, we said we didn't know, and we might change our minds in an hour, and we did many times based on new information. And I'm super proud of our teams for trusting us to the level that they have, and they still do today, that they believe that we are putting them first.
Mobilizing the team for testing was a huge undertaking, and it really showed the best parts of our organization. It showed how we can do wonderful things together.
The anxiety, there was the fear, but there was also kind of this excitement and curiosity. We tested very high volumes of patients, and it was mentally exhausting, physically tiring, emotionally draining, and every day you left work tired. You felt like you had lived a very full day.
We did a lot of things first with testing, whether it was moving things indoors, doing saliva testing, setting up drive-through testing here in Utah. What made us able to do that is, as a culture, we're always asking, what next?
When I first started, we were still doing deep nasal swabs, and while it's pretty weird. Every single time that you would swab someone, you were a little shocked by how far that swab had to go. And I know for patients that it was not the most comfortable experience for them. So when we started to hear this word of, hey, we might be switching to saliva testing, we all were like, how's that gonna work? That should be awesome, but what's gonna happen? And
our colleagues at ARUP were really pushing to find a better way to test that was more acceptable to patients than having that swab tickle the brain, as people have said. And that was a barrier for a lot of people wanting to get tested. Well, how can we make that easier for people to want to have that done? What can we do about not having people sit in their cars for hours waiting to be tested? And so we came up with appointments as a way to still test the same number of people, but to make it more convenient for them. Moving things indoors when it became obvious that we were going to be doing this through the winter, and we didn't want to have our staff suffer through the winter and worry about ice and snow. And so all of those things we did, coming together as a team and just creating that future with open-mindedness and really that kind of co-creativity. So we quickly went from testing our community to testing for the vice presidential debate.
We supported campus. It was a University of Utah event. We were the healthcare partner to provide care and support, but the twist was COVID. So we also then had to provide testing into that secure and safe environment. Not one person went into that circle that had not been tested and cleared.
I'll tell you a little secret about the vice presidential test. I think we ended up going with Plan G. Plans A through F we had to discard for various reasons. And it was just, again, that determination that people had to say, we're going to be successful at doing this no matter what it takes.
We delivered a basically flawless event under the most dire of circumstances.
It's pretty extraordinary to see leaders step up in an amazing way, to see our staff step up in the most, extraordinary ways that I can't even imagine.
Our environmental services team has said, me first, let me go in, let me make sure everything is great for each and every one of you and safe.
With the environment team, we do the cleaning for everything, whatever we have in hospital, like these organizations. Because of the COVID persons, we have a different isolated room and everything we need to clean. If we did not clean, then all the environment become polluted or disinfected, not good for the patient, and maybe they harm for other diseases.
And early on, it was scary to kind of come in and cleaning a room. We didn't know. There's a lot of things we didn't know.
Some of our team leaders and both give us, they go up front and they show us how to handle that thing. Then we are encouraged to go there, and we do it right now too. First time we are scared, everybody in the team, we are scared to handle the case, but we know we need to do that one, and we tackle them, and we are winning right now.
They've come up to bat, they've gone into our rooms, they've been part of making sure that for our patient care and for our nurses and our clinicians that they have the safest environment possible to deliver patient care.
Pretty remarkable to see that, okay, you know, we're going to be okay. We're going to come into this, and we're going to work through it together.
It makes me feel good that people come up here and appreciate us. So.
That's probably one of the most sentimental components of COVID-19 for me personally, as leading out on much of the community donations and interaction. Just from a 12-year-old young man concerned about us and wanting to come and drop off a $250 check that he had raised from reading a book, to restaurants, to community members donating hundreds and hundreds of meals. Hundreds of thousands of dollars have been donated to our teams. Our nutrition care services created a grocery store, created take-home meals to be able to make life even just a little bit easier. The day of the F-35 flyovers, it was just amazing to scan, from looking at Dr. Good, our Senior Vice President for Health Science and CEO of our healthcare system, to our former CEO, Gordon Crabtree, and just so many staff members. It was uplifting, it was so meaningful, it was emotional, and it was just an incredible show of solidarity.
Late August, when the college campuses started to reopen and high schools started to reopen, there was a huge surge of disease in kids. It hit teenagers the hardest. I think we all expected a fall peak based on what we'd seen in the past with influenza pandemics.
At one point, MICU was full and B50 was full, and it became this like, crap, like, where are we going to put these COVID patients?
The amount of death that was happening after prolonged stays in the ICU, the amount of isolation that these patients were in, and how limited it was to have a family member present, trusting you, communicating with you, because they just couldn't be at the hospital. That really impacted all of the dying.
Like what I've seen, and patients have to die alone sometimes, and it's just sad. Like having a patient come in with COVID and having it be 4 in the morning and being like, we have to intubate you. Please call your family. This might be the last time you will ever speak to them ever again. And you just knew that if they got intubated, it was a long road. And there's nothing you can do. To say it's been emotional, it has been very emotional.
My father-in-law was a patient in the medical intensive care unit for a time, and to see the teams care for all of the COVID patients that were in our unit at that time was nothing short of inspiring.
You have to keep going. You can't stop. Nobody else is going to take your place. You have to keep going. And for that one person who passed away, you've got 12 others that need care, that need somebody that can give them information or solace or something. So you just have to keep going.
Knowing that a vaccine was coming, that was super hopeful for healthcare workers.
I was the first to get the COVID-19 vaccine.
I never was fully sure that the first round of vaccines would work. We had never made a successful coronavirus vaccine. So I was hoping to hear some modest efficacy. And when we saw the first results suggesting efficacy of over 90%, that was, probably the best news of the fall.
For me, the overall feeling I felt was excitement. Really, because it was a solution. I think over the last year, all the work we've been doing on COVID was just maintaining. There really wasn't any kind of major solutions out there. From the pharmacy perspective, all the medications we had were primarily for maintenance and really trying to do no harm to the patient. This is truly a solution, so the excitement of actually implementing a solution, something that can actually get us back to something close to being normal. We recognize that we could have sat back and tried to come up with a perfect plan for trying to vaccinate our staff, but honestly, when it came down to it, we recognized that the vaccine's coming in on a certain day. How fast can we get into our staff? We didn't want to be seen as sitting around waiting.
I'm kind of an old guy. I have a family, and I want to see my friends and everybody I work with and myself be protected from this nasty bug.
So we went straight to the MICU, the Medical Intensive Care Unit, as well as to the ED, getting those staff members vaccinated right away so we didn't have to delay.
When I got my vaccine, I felt, proud that we had in 12 months developed highly effective vaccines. I felt a sense of gratitude that as a healthcare provider I could be in the first tier. I felt kind of humbled because I knew how many people were waiting for it.
I was excited about it, but I also had this overwhelming sense of guilt too, because in the ICU we're caring for these COVID patients and we had the most PPE. All these other people that are at greater risk that have to be out there, working in a fast food restaurant aren't getting the vaccine.
But as you walked and saw folks in lines or going to the vaccine clinic, you saw the creases in their smiles outside their masks, or you saw in their eyes. And just the last year's been tough for a lot of people for a number of different reasons. And just seeing people just being happy, whether it be a staff member or a patient, recognizing that, again, we had a solution in place, and you got to see people just be happy for the first time.
I do feel like it was a turning point. I feel like our numbers started to decrease a little bit, and they stayed high, but I think just knowing that, okay, eventually more people will be vaccinated and this will be over, it gave us another boost of energy.
I think that they've been events occurring within the organization that has tested us, but never to this level.
Shortly after COVID-19 really took hold here, we had an earthquake. That was scary and terrifying. We had a disaster within a disaster, but then we thought that was over. Then we had a microburst here at the University Hospital that took one of our tents down in a matter of minutes. A few months or weeks later, we also had fires. We had a dry hurricane that hit the state of Utah, for crying out loud. And I think at some point, everyone's beginning to wonder, is this it? And what else can this system, can this community, can this state take? But we also had civil unrest, and our whole entire country and globe experienced that along with us.
I think that it's almost artificial to talk about COVID-19 and racial disparities without talking about Memorial Day of last year. The murder of George Floyd changed how everybody in this country thought about race relations. And then that actually worked together with the data that we had on health disparities to actually have people caring about equity and racism and systemic racism in healthcare.
We became aware of more disparities across, how healthcare is delivered to our various communities, and that became really apparent. And a lot of our healthcare workers were really emotional with some of the patients that they cared for. So that's been something that we need to work at, but I think it also showed us, made us more aware, and I think that's the first step.
I had a Native American woman say to me when I was approaching her about enrollment in clinical trials, that she said, "My people are not represented in your trials. How do you know that this drug will work for me? How do you guys know that you are providing the right care for me?" And so I think being able to, being confronted with those questions does make you take pause and make you think, okay, we have so much to learn.
Are we doing a better job of reaching all parts of the community? Is the same level of health care available to people from every group in the state? And I don't think we know the answer to those things yet. I think the desire is here, but let's see how we turn it into action.
Systemic racism exists in medicine and in medical systems. All right? COVID was teaching us that already. The aftermath after the murder of George Floyd made it clear to everyone. And then people started saying, let's look at the data, let's look at the data, let's find the answers in these data. And so now we're in a better place because now we're understanding what our role is in health disparities.
We didn't lay anybody off. We had child care support. We had various payments that we provided. We redeployed our teams, and we were very committed not to abandon our employees.
We changed and adapted. Different groups worked together to do a bunch of remarkable things.
Life and the world throws stuff at you that you're not prepared for, but if there is any doubt, I think that we have proven we can, as humans, survive, and we are resilient, and we will care for one another.
Can we make it so that we can handle something like this should it ever happen again? I have no doubt in my mind we can do that. Can we address systemic racism? No doubt in my mind we can do that. But how we do it, I think, is what's going to really define us.
I have felt a sense of belonging, like a greater sense of trust and deeper relationships with my colleagues that probably would not have come about if we hadn't all been under this stress together.
It's appropriate to look back and acknowledge the difficulties, acknowledge the stress, acknowledge the pain, acknowledge the loss, and also to take a little bit of positivity out of that, how we've been able to persevere.
What we knew then versus what we know now. We know masking works. We know we have an effective vaccine. There's so much more that we have control over that it's an entirely different scenario now as it was back a year ago.
We are the University of Utah, and we are the university for Utah. And it was important to us because we have not just a moral obligation, but actually a contractual obligation to serve our patients and to serve the state of Utah as a whole.
Knowing that there is a light at the end of the tunnel and this will be over and this won't be our lives forever, that's just amazing.
We have changed, but I think in a way that would actually highlighted what's best of university health, what's best for university hospital clinics has all been highlighted through this last year, and I couldn't be more proud to be part of the team.